I'm Daniel.
The topic we want to share with you today is more resources into the mountains, improving the medical care in rural areas.
It's time to evaluate again. What a hassle.
No way. This is also to allow the hospital to obtain more resources.
Taking care of patients already makes us really busy. And I also have to prepare the nursing notes of each patient, and even create a year's meeting minutes. Did you know I didn't sleep at all last night?
Me either. It's so annoying.
Doctor, we decided to let our son perform the operation.
Sorry.
Wait a minute. Your hospital didn't have enough equipment to complete this appendectomy.
The medical workers in rural hospitals can't perform major surgeries because there are not many patients. Medical supplies and equipment can't be maintained in good condition, so these supplies and equipment may get rust or greatly become useless.
As for the shortage of employees, the authorities concerned should recruit local people to admission them to medical department and ask them to work in rural areas for 10 years.
Moreover, the medical workers in rural areas often work overtime due to the shortage of medical workers.
That's right. I've been so tired recently, and I have to take care of my kids every day after work. It's so annoying.
My classmates who work in large hospitals are more tired. They keep working while they are pregnant, and some of them even have preterm birth or miscarriage due to overwork.
It is common for doctors and nurses to work overtime now. As an administrator, we also have to catch up on projects. The workload is very heavy. Overworking and working overtime make us feel miserable. In addition, most of nurses are women. There are often silent treatment, quarrels, and work disputes. Nurses usually help patients in person, and the healthy healthcare system will not work without reasonable working hours and a friendly workplace for nurses.
We hope that the exclusive content person in the Ministry of Health and Welfare can keep the communication with the medical workers open. Through communicating with medical workers, the Ministry of Health and Welfare can help solve their dilemma with full transparency and openness.
There's a nurse at the hospital I worked at. Because she was taking care of a 2-month-old baby, she was burning the candles at both ends with her work and family. Also because of too many cases of nannies abusing children, she dared not to hire nannies.
With financial pressure, she couldn't take a long maternity leave. She has missed many times and gritted her teeth to survive. In the end, she has to ask her mother-in-law to take care of the baby. But the baby did not like bottle feeding. Peggy was also warned by the nurse not to bring her baby to work, which became a bad chore for Peggy. She decided to quit.
The National Health Insurance Administration requires health facilities to promote a baby-friendly environment. However, after the mother returns to her workplace, the baby was accustomed to breastfeeding, but the director of the hospital do not provide a reasonable baby-friendly welfare system.
That's right, there is no baby-friendly workplace for female medical workers. In July 2019, the Ministry of Education issued the Children in the Workplace policy. To establish a friendly environment, childcare is very important to two-earner households, especially when the working mother who are still breastfeeding cannot strike a balance between childcare and work. Then they might face the dilemma to quit or to be a mother who neglects her duty.
This is not a problem for a few people, but a problem faced by many two-earner households all over Taiwan. If the Ministry of Education could ask more companies to do their best to promote it, the problem of babysitting for many two-earner household families could be solved. Speaking of this, I thought of a really interesting book called Mad Doctor. The predicament in the medical workplace described in the book is completely in line with what happens in our daily life.
I read the book too. The content is really interesting, with intriguing and humorous stories. Readers can understand the plight of rural medical workers and listen to their authentic thought and voice, such as the impact of national health insurance on doctors and nurses. Some nurses suffer from preterm birth or miscarriage due to overwork. Some medical workers are involved with medical disputes in rural areas. These issues are worth exploring.
The author also added lovely hand-drawn illustration in the book, makes readers want to pay attention to current medical care in a simple and interesting way.
Who is the author of this book?
Liu Zhongyu, nicknamed Dr. Xiaoliu. She graduated from the Department of Medicine of Chang'e University. She became a surgeon in 2011. Now she is a surgeon of general surgery and breast surgery at Yuan's General Hospital.
She often shares some surgical clinical experience and what's happened in hospital and social media, and pays more attention to the issues of medical workers and their human rights. The rights of medical workers are very important. One of my friends is a resident. She always got first place at school. At the final stage of PGY, she was ready to choose her medical specialty. The professor thought she would choose internal medicine department, but she decided to choose aesthetic medicine department in the end. She refuted and pointed out that the national health insurance system is not fair to doctors.
Nowadays, many doctors would like to choose aesthetic medical department and department of plastic and reconstructive surgery because it is a chartered medical service. Running a private clinic is more profitable, so it becomes the first choice for many young doctors.
After September 1st, 2019, there are about 4,000 resident physicians in private hospitals who were included in the Labor Standard Act. But most of the attending doctors who were employees were still not assured by the Labor Standard Act. It is still what the medical law needs to specify to assure doctors' right to work. Jongwei, a doctor in Cathay General Hospital, said that rural clinics are often on holiday. Hospital outpatients are reduced, so the doctors in the emergency room need to work very hard.
According to the statistics of the National Health Insurance Administration, last year, 1.06 million patients went to the emergency room for mild symptoms. It was 15% of the total emergency room patients. That is, 1 out of every 7 emergency room patients had mild symptoms.
Nearly 30% of patients are unable to judge whether their illness is severe or not. The National Health Insurance Administration should make more people involved in the local family medicine clinics. But Taiwanese are not used to seeking help from family physicians.
The main part of community medicine is a chartered medical service. If the resident can trust the local family physician, it can gently reduce the waste of emergency medical resources.
Abusing medical supplies is becoming more and more common. They occupy hospital beds without registration, and even rent shares to patients and their family. The behavior of abusing medical supplies should still be prohibited. In this way, medical workers and patients have a friendly and safe medical environment.
In Lala Mountain, a British tourist was bitten by a poisonous snake. Dr. Ye Weizong of Hualing Medical Station took out an illustrated handbook about snakes in Taiwan for the tourist to identify which snake bite him. He found it was a Potobogros. After being bitten, the wound will be painful and even have bruises, bloody blisters or blisters.
What can we do to make the tourists identify venomous snakes to prevent them from getting bitten?
We connect the Fuxing Township Health Center, Nalasan National Scenic Area Administration, and design to make a brochure to introduce poisonous snake in the Nalasan. We hope that local people can learn more about poisonous snake in the Nalasan, so they could be aware of poisonous snake anytime.
The national health insurance in Taiwan are world famous, but it did not bridge the gap between urban and rural areas. Professor Jiang Dongliang pointed out that it has been 50 years since the national health insurance had launched it, but the reduction of health inequalities has not been considerable.
Since 2002, Linkou Chang'e Memorial Hospital has worked for the National Health Insurance Administration with the IDS project. The National Health Insurance Administration keeps investing for 20 years in rural areas. They set up Hualing Medical Station to provide the 24-hour medical care. The medical workers from the IDS project track and treat the patient with hepatitis B and C.
The funds for the IDS project are about 12.8 million NT dollars every year, and satisfaction of the patients is as high as 97.6%.
The implementation of IDS project in Fuxing Township, Taiwan City has achieved excellent results. But the problem that we think that needs to be solved urgently are that attending physicians are applicable in the Labor Standard Act, and that the authorities concerned have to deal with the shortage of emergency resources and the shortage of medical workers in rural areas. current condition of medical care in rural areas on campus, to call our schoolmates to reduce wasting medical resources.
For example, we distribute a form for our schoolmates to write down what medicine they have at home at the school fair.